Hello, Ms. Parker.
Hello.
Hi, I'm Dr. Muglia. I'm one of the psychiatrists and I've been asked to come and see you. I understand your GP's referred you as you've got a 3-month-old baby and there's been some concerns with you washing your hands repeatedly.
Yeah.
I can understand it might be a distressing time for you, but if it's okay, would you tell me a bit more about the washing of your hands?
Okay, yeah.
What would you like me to call you?
Oh, Pam is okay.
Pam?
Yeah, yeah.
Okay, Pam, can you tell me why you've been washing your hands repeatedly?
Well, I'm worried about contamination and if I were to pass something on to harm the baby.
Okay, so that seems to be a concern for you.
Yeah.
What is the contamination about?
It's germs, because there's germs everywhere, isn't there? And I'm worried that if I have the germs on my hands and I touch the baby's, you know, they don't have very strong immune systems when they're very young, and I'm worried I'm going to harm the baby.
Okay, I can see Pam, you're going through a really difficult time. What's your baby's name?
Josh.
Josh,
Yeah.
Okay. And Josh is 3 months old?
Yeah, yeah.
Okay. Well, congratulations on your baby.
Thank you.
But I can understand at the moment it's quite difficult
It is
because
difficult.
of this concern.
Yeah.
So what happens when you, is it a thought that you get?
Yes, I get this thought in my mind that, you know, if I'm about to change Josh, if I just think if I touch him, you know, what have I picked up in the time since I last washed my hands?
And what happens next?
Then I just can't touch him until I've washed my hands.
And what happens if you try to resist the thought?
It's like I try to go to touch the baby, but then I think, no, you know, what if I've picked up something and then that's gonna, you know, I'm contaminated, and then I pass that on to the baby and then the baby gets ill.
That must be quite difficult. And you told me, Pam, that you wash your hands. So how many times have you been washing your hands?
I don't know, 40, maybe more times a day.
And how do you feel once you've done that?
Better just for a little while, but then it's like the longer it is since I've washed my hands, the more I start to think, well, have I picked something else up, you know, in the meantime.
And for how long has this been going on?
It started about 3 weeks after the baby was born.
Okay. So Pam, what you've told me so far is that for 3 weeks, since Josh was born, you've been washing your hands repeatedly and you're concerned that you might be contaminating Josh with germs, and that you've been washing yourself up to 20 times.
40 more.
40 times.
Yeah.
So for me it sounds like it's quite distressing for you. Apart from washing your hands, have you been doing anything else?
I'm struggling to sleep, but I'm not doing anything. You know, it's just really the washing of my hands is the most important thing.
So when you go and have a wash, how do you manage?
To wash my hands?
No, to have a bath.
I mean, I have a shower because I think that's cleaner. I don't like the thought of sitting in germs. But I have a shower and I wash myself, and then after the shower, then I would, obviously because I've been touching myself, then obviously I have to wash my hands.
Okay. And do you have any other rituals that you've been doing?
No, it's just the hand washing is the main thing.
Okay. Sometimes people, when they have similar type of behaviors what you're presenting with, they might have some checking behaviors. Do you have a habit of checking certain appliances or checking if doors are closed?
I've always done that a little bit, but it's no more than I mean, I think that's okay. It's kind of regular checking, I think.
Okay. And just to clarify, the thought that you get in your head, is it your own thought that you get in your head?
Yeah.
Okay. And sometimes do you feel that you might get any images or any other thoughts apart from the one that you're experiencing?
No.
Okay. And how have you been feeling in your mood as a result of this?
I feel it's dragging me down really, because it's quite exhausting, and I feel very tired and just not very bright really, not that happy.
And how have you been coping with Josh?
My mother's been helping me a lot, and my husband helps as much as he can.
So you have some support at home?
Yeah, I do have, my mum's helped me quite a lot, yeah.
And is Josh your first child, or have you had any other pregnancies?
No, he's the first baby, yeah.
Have you seen a psychiatrist in the past?
No, I haven't.
And is there any family history of any mental illness?
I don't know if you'd call it mental illness. I know my mum spent some time in hospital after I was born. I think she was depressed. I think her mother too, she said she was depressed. I don't know much about that.
So there might be a family history of depression.
I think so, yeah.
Okay. And can you tell me, are you on any medication at the moment?
No, I'm not, no.
Do you have any physical health problems?
No.
Do you think you've bonded with Josh?
It's difficult because touching him and holding him is, I don't want to pass anything on to him, so I'm worried that we're not. I feel almost a bit nervous of him.
Yeah. Is there any chance, I'm sorry to ask, but is there any chance that you might want to harm Josh or might harm yourself?
No.
Have you ever had such thoughts?
No. I mean, it's the opposite. I want to make sure I don't contaminate. I'm not contaminated, so I don't pass anything on to the baby.
I can see, Pam, this is really a difficult time for you. If I can just summarize, and thank you for talking to me. From what you told me, since Josh is 3 weeks old, you've been washing your hands repeatedly and you're concerned that you might be contaminating him with germs. I would like to see you and discuss more about the medication and psychological therapies that is available. Thank you for talking to me.
Okay, thank you.